Welcome to the New Mom Talk podcast, your go-to podcast for evidence-based answers to your burning questions about parenting. Join us as we dive into commonly Googled topics and hear from experts and real moms. Let's navigate parenthood together, one question at a time. Hi, everyone. Today we're going to talk about high blood pressure and how that's a very important thing to consider when it comes to pregnancy and postpartum. So I'm going to go ahead and hand it over to you if you can start off with telling us a little bit about yourself and what you do.
Lovely. Yes. Lovely to be here. Thank you for having me, Mariella. So my name's Dr. Fran Conti-Ramsden. I'm a clinician, so I'm an OBGYN resident here in the UK, in London, halfway through my residency training. So I work on labour ward, I work in antenatal clinic, covering obstetrics and gynaecology. I'm also an academic. So I've been working in the field of pregnancy hypertension in a research capacity for about 7 years. And I've just completed my PhD, had my viva last week. And more recently, I have been working in a part-time role as Chief Medical Officer at Meggie Health, really thinking about how we might be able to use technology to improve education and outcomes for women who have blood pressure problems in pregnancy. So yeah, pleasure to be here.
Oh my goodness. All of that just sounds so amazing. And congratulations on just finishing your PhD.
Thank you.
So I'd love to just start off with the basic. What causes high blood pressure during pregnancy? And then we can kind of start jumping a little bit more in depth into what that even means and what it can look like.
Yeah, absolutely. So I guess one thing is to understand that blood pressure problems in pregnancy are a whole spectrum of conditions, right? So some women enter with a high blood pressure already. So quite a lot of women, sort of estimated about 2%, but it's increasing, have got what's called chronic hypertension. So that means they have pre-existing hypertension and they go into pregnancy hypertensive. And what's interesting is that because high blood pressure is completely silent, right? You can have absolutely no symptoms. Pregnancy is often the first time that we pick this up. And so that can be the first time that women actually are having their blood pressure checked and realizing that it's a problem. Then we have a whole other set of conditions which are pregnancy specific. So they are blood pressure problems that arise for the first time in pregnancy. And we generally group these into what's called gestational hypertension. So that's just high blood pressure. And then preeclampsia, which probably people may have heard of, or if someone that they know has been unlucky enough to have it, is a combination of high blood pressure and other problems such as any organ dysfunction. So it can affect really any part of your body, the brain causing seizures. It can affect the liver, the kidneys, the heart. In terms of what causes blood pressure problems in pregnancy, I mean, we're still trying to work that out. It's what we call a complex disease. So that means that, there's lots of different contributing factors. The best way we can understand preeclampsia at the moment is kind of grouping it into two different camps. So one is the preeclampsia that develops from very early in pregnancy, what we call early onset preeclampsia. And we think that's related to challenges with the placenta forming early on in pregnancy. So what you need for a healthy pregnancy is actually for your whole heart and circulatory system to change, to go from a low flow, high resistance circulation. So if you imagine like tubing, like pipe work or plumbing, when in a non-pregnant womb, you don't want lots of blood going because you would hemorrhage every month, right? But when you're pregnant, you need to be able to grow, a very rapidly growing baby. And so you need that blood supply to completely change. And in this early onset preeclampsia group, for some reason, this process doesn't occur in the way that the sort of the optimal way. And you end up with, rather than having lots of blood flow to the placenta, of a circulation that's not meeting the demands of the growing baby. And so that means from the off, the baby's struggling to grow in the way that it could do, and also means that leads to a lot of stress and damage eventually to the mother's organs as well. So that's kind of the early onset type. And then later on, the late onset preeclampsia, we call it like a pot-bound placenta, right? So preeclampsia is sort of as a placental condition, and I know I'm covering a huge amount of ground here. But so pot-bound placenta is the idea that any placenta will eventually run out of gas, basically. So every placenta's got a lifespan. And so, for example, if you've got twins on board, or you're growing a lot of baby, that placenta is not going to last for as long as for a single baby, for example. And placentas just come in different shapes and sizes, and some of them last longer than others. But the idea is that at a certain point, the demands of the growing baby outstrips what the placenta can provide. So if you imagine your house plants, if they've been in a pot for too long, the roots get really tangled up. And this is the idea of the late onset preeclampsia that we're seeing. The needs of the baby can no longer be met. And again, that stresses the placenta, and that leads again to the damage that we see on both the maternal and the dangers to the infant side. So we still don't know is the honest answer, but that's sort of the ideas that we have around why these conditions develop. And what we do understand now pretty well is that many of the same risk factors that we see as risk factors for heart problems, so cardiovascular disease, they're the same risk factors that you see for preeclampsia and blood pressure in pregnancy. So you can almost think of pregnancy as a stress test about your heart health, because there's a very strong relationship between the two.
Wow, I really love how you just used very descriptive, easy to picture things like the plant, the house plant, right? Because then it really gives you this idea of like, I didn't know that that's what it was. So that said, I would love to see if you could start off with maybe some early warning signs or symptoms that expecting mothers may have. And I know that you
Yeah,
said it's kind of hard to know,
yeah.
but
Yeah. So, one thing I think one of the things that's really important to understand about blood pressure is that it can be silent, right? So, one of the things that's important to appreciate is that that's why we have to measure blood pressure regularly in pregnancy, because you could have a high blood pressure and have no symptoms. Like, that's really important for people to know. That's why every time you go to your midwife or your doctor, they will measure your blood pressure because they're checking to see if it's raised or not. An element of this is that you have to keep checking the blood pressure, because really there's no other way to be absolutely sure that something isn't changing. And we know roughly 1 in 10, maybe it's possibly getting even higher now, maybe as many as 15% of women will have some form of blood pressure problem in pregnancy. So it's common. There's no group of women that you can say, yeah, you're fine, we don't need to look at your blood pressure. Every woman needs to have their blood pressure checked regularly. So that's really important, to measure your blood pressure regularly as guided by your specialist, and to understand what the numbers mean so that you know when you need to seek medical attention. That said, preeclampsia can become symptomatic. It tends to become symptomatic as it becomes more severe. So the disease process can start, as I was talking about in early pregnancy, it can start really from the beginning of pregnancy, but it doesn't manifest into problems until later on. And some of the classic symptoms and signs that we tell women to look out for. And there's actually some really great resources on the Preeclampsia Foundation website. So if anyone wants to have, if you're a bit more of a visual learner, they've got great infographics, and they've got great videos as well on there. But classic things are headaches, sort of severe headaches, also vision problems, so like spots in your vision. And that's, related to the brain becoming affected. You can also get stomach pain, particularly pain on the right side of your tummy if the liver's becoming affected. So that's another key thing. And then severe swelling, particularly of the hands and face, and sort of rapid weight gain as your blood vessels are becoming affected and you're retaining water in a completely different way. And also nausea and vomiting can sometimes be an indication. Obviously, a lot of women experience nausea and vomiting throughout pregnancy, but again, sort of looking for that change. And it's tricky because these are symptoms. Obviously, a lot of women get swollen in pregnancy. A lot of women are nauseous in pregnancy. So it's hard to say 100% that's what the cause is going to be. But I think it's having that awareness, and also the feeling that like something isn't right. Is always better to err on the side of caution and get checked out. But also bear in mind that, you don't always have symptoms, and you can still have preeclampsia, either sort of evolving or sometimes quite severe. So I've seen women who are walking around, they feel well, and then, you check their blood pressure, you do their bloods, and you're like, my God, they're really sick, but they just happen to not have symptoms. So that it's not necessary. Some women have symptoms, but some women don't.
and just for clarification, high blood pressure in the medical field is known as preeclampsia. So they are one and the same, correct? Hi, everyone. It's your host, Mariella. I want to thank you for listening and share some ways to show your continued support. You can rate and review on Apple Podcasts or Spotify. Share the show with friends and family. Buy me a coffee to help with the financial costs of running a podcast. Follow me on Instagram at newmomtalk.podcast. And finally, subscribe to my newsletter. Thank you for listening.
It's a little bit more complicated than that. So, like I said, high blood pressure is the finding of, in pregnancy, we use a cutoff of 140/90. So if you have a blood pressure of 140/90 or more, 2 or more readings, you have that makes you hypertensive. The hypertension itself can be related to a couple of those different issues. So like I said, the women who have high blood pressure in early pregnancy under 20 weeks, we actually classify that as chronic hypertension because that's really related to their pre-pregnancy health. So that's very likely to be their health beforehand rather than a pregnancy specific problem. So generally speaking, if a woman's got high blood pressure under 20 weeks of pregnancy, that's classified as chronic hypertension. Whereas women who develop hypertension for the first time after 20 weeks, that can be either gestational hypertension or preeclampsia. So there is nuance. There is nuance there. And just because you have high blood pressure doesn't mean you necessarily have preeclampsia, but that's certainly something that if you have it for the first time, your doctor will be wanting to work out, is this preeclampsia or is this not? Because that's quite different. Preeclampsia, some people admit all cases of preeclampsia, some hospitals, some people will do outpatient management. It varies. Whereas if it's just, she says, if it's just high blood pressure alone and you don't have preeclampsia, you can sometimes manage that as, that's often managed as an outpatient. So you don't have to be as closely intensively monitored as preeclampsia.
Okay, so a high blood pressure is kind of the umbrella or like the base, and then you can have all of these
different
other
diagnoses.
just depending.
Absolutely.
Okay.
Absolutely. And that's why you need assessment, because when you have high blood pressure for the first time, they need to work out what's the cause. And then once you've got the right diagnosis, then everything follows. And the other thing is that pregnancy, things really change over time, right? So you might start off with no normal blood pressure, and then your blood pressure goes up and you have a label of gestational hypertension. So that's just the high blood pressure piece. But then that could evolve into preeclampsia a few weeks later. So that's why in pregnancy, it's very different to blood pressure outside of pregnancy, to hypertension outside of pregnancy, where, it tends to be much more stable, but things in pregnancy really change very, very quickly. So that's why you need to be reassessed. And if you have new symptoms, you need to go back and to get checked out.
Thank you for all of that. So we did talk a little bit about how high blood pressure can affect both mom and baby during pregnancy. So I'd love to shift it over to that postpartum period. Like, how can this affect either just mom or can it impact both mom and baby?
Yeah, absolutely. So I think it's worth one thing that's really important to know is that you can develop these problems for the first time after birth. And I think a lot of people don't realize that. So, and we've actually I've spoken to women who have been gaslighted by medical professionals. So they've presented with symptoms of preeclampsia postpartum and they've been told postpartum preeclampsia doesn't exist. And that's not true. So you can develop high blood pressure for the first time after birth. And actually, everyone's blood pressure rises in the first kind of week after birth because there's a lot of changes. All the fluid that you've accumulated during your pregnancy starts to shift back into your circulation and you start to pee it out. And that raises your blood pressure. So you can develop high blood pressure for the first time after birth, and you can also develop preeclampsia after birth. So it's those same symptoms, those same warning signs, becoming hypertensive, it can happen, and it's really worth being aware of that. From a risk perspective, actually, for the mother, the postpartum is perhaps even it's as risky a time. And if you look at it's I always worry about talking about it because you don't want to scare people, but sort of really severe adverse outcomes like maternal stroke, for example, the majority of those happen in the postpartum period. They don't actually happen antenatally. So, there are one of the key things when it comes to preeclampsia and blood pressure in general is keeping the blood pressure controlled. Like, that's really, really important. And we do that through medication. during pregnancy and the postpartum. And one of the things that we do know is that good blood pressure control is really important to reduce the risk of those adverse outcomes, particularly maternal stroke. So that's why, we take blood pressure really, really seriously. So yeah, for the mother, preeclampsia can be incredibly dangerous. So it can progress to eclampsia, so seizures that can happen antenatal and postnatally. It's actually more common in the postnatal period. Like I said, it can affect any of your organs. So it can lead to damage to the kidneys, damage to the liver. It's associated with a higher risk of an abruption. So that's when the wall of the placenta comes away from the wall of the womb. And clearly that can be catastrophic, very dangerous for both the mother and the baby. For the baby, one of the big things is the growth, right? So we've talked a little bit about the fact that the placenta, particularly in that group of women who develop preeclampsia very early on in pregnancy, that placenta's not been functioning well from the beginning. And so that means that the baby's growth is affected. And so often we can see that the babies are smaller than they should be. And the other big thing that we see related particularly to preeclampsia is preterm birth. And a lot of that is what we call iatrogenic. So it's the clinicians who've it's not that the woman has spontaneously gone into labor, it's that the clinicians have had to deliver the end the pregnancy for the safety of the mum and the baby. So we also see a lot of preterm birth. And obviously that can have quite a big impact on the infant. We know that actually from 32 weeks, the long-term outcomes are really, really good. But, from 20 to 32, that can have quite a significant impact on that baby's life trajectory, and under 28 weeks even more so, and that you start to get significant risks of the baby not surviving as well. So a whole host of issues. And it's at the moment, one of the things that's quite sad is, like, in many areas of maternity, because there hasn't been so much research and development, we don't have very many good drugs to treat this disease. So at the moment, the only treatment that we have to prevent preeclampsia is aspirin. And so if you're identified as being at risk, aspirin is really strongly recommended. It is incredibly safe. It's been used for donkey's years now. And we know it really reduces the risk of early onset preeclampsia. So you start it from 12, ideally starting it before 16 weeks, taking it through to 36 weeks of pregnancy. And that's actually pretty much one of the very few things that we can do once the disease has developed. Our only option really from an obstetric perspective is thinking about the timing of delivery. So we're balancing the risks of the mum and baby potentially becoming sick with the baby potentially being a bit early. And so when you're at sort of 28, 29 weeks, you're trying to get further on in pregnancy. Once you get close to 37 and the baby's better grown, then you would be looking at an earlier delivery. So that's really, delivery is actually the only treatment that we have once this disease develops. And I very much hope that in my working life that will change, but at the moment we don't have any other treatments.
Are there any steps that moms can take through, whether it's like lifestyle, nutrition, medical care, that can help them reduce the likelihood of developing high blood pressure, or if they do have it, managing it throughout that time, especially
Yeah.
if it is chronic?
Yeah, absolutely. That's a great question. So I'll start with the second half. So there was a brilliant trial published in the New England Journal of Medicine a few years ago called the CHAPS trial, published in 2022. And they compared women who had chronic hypertension, so the women who've got pre-existing high blood pressure, and they looked at starting treatment at 140/90 versus 160/100 blood pressure. And what they saw was that the women who started treatment sooner and had their blood pressure better controlled, they actually reduced the risk of progressing to preeclampsia, as well as better maternal and infant outcomes. And I think there's lots of different pieces of research sort of contributing to this puzzle. But I think if you become hypertensive, controlling your blood pressure with medication is probably one of the most effective ways of reducing your risk and keeping you and your baby safe. So I think that's really important. I think women, and I get it, when I was pregnant, I didn't want to take any medication either. You're kind of allergic to taking stuff. Like, you really don't want to take medication. And I think it's really important your healthcare providers to have those conversations that can reassure you and go through your concerns. But yeah, good treatment of blood pressure is I think is really, really key here. In terms of being able to reduce your risk, I think there is some, like I said, a lot of the risk factors for preeclampsia are your general cardiovascular risk factors. So it's a lot of things we can't control, things like age, a family history, those are things that we can't control, but there are a few things we can control. So one is body mass index, your weight. And there is some data now as well to suggest that maybe diet could reduce your risk. I think it's still early days. Actually, the international guidelines now do recommend exercise as a way to potentially prevent preeclampsia. That is recommended now. So certainly keeping active in your pregnancy, and actually also it's going back to pre-pregnancy to really get yourself to a healthy weight, healthy lifestyle, all the same things that we recommend for heart health. It translates over because these conditions are, they're interrelated.
Yeah, and it totally makes sense, right? You wanna be healthy, and those are the recommendations if you're not pregnant to stay healthy.
Yes, exactly. And so it's much the same, it's keeping active, having a healthy weight, having a healthy diet, being smoke free. Having said that, one of the sort of mysteries of preeclampsia is that you can be ticking all those boxes and it can still happen. There are some, I think there's aspects to this that are your pre-existing kind of heart and circulatory system health. There's part of this which is probably genetic, and then there's part of this which is sort of specific to that pregnancy. So we know, for example, first-time mums are more likely to get preeclampsia rather than second-time mums. So there's such a complex disease that I also don't want people to feel like they've failed or that it's their fault if they've developed it, because there are some things that you can control and some things that you just can't. And I've seen, across the board, women who are incredibly fit and healthy and young, and they can develop it. So it's sort of you can only control so much. But I think from our perspective, what we want is for women to be, checked regularly, to know the signs and symptoms, to feel empowered to speak up if something doesn't feel right. And because with the right medical care, this is something that can be managed and should no longer be dangerous for women. But unfortunately, when you look globally, this is still a huge, huge contributor to both maternal mortality as well as infant mortality and morbidity. So, that's why antenatal care, getting those regular checks, having the right information and treatment is so critical.
Well, and also with just being pregnant, like, sometimes it's hard to work out. I was super active my first pregnancy, and my second pregnancy, I could barely walk a half mile
Yeah.
because I was so iron deficient, and so every pregnancy
Yes.
is gonna be so different, and hopefully
Absolutely. Absolutely. And you can't beat yourself up with a stick, and I think, I see so many women who, and they're like, this is meant to be this amazing time, and it's just been so hard for me from day dot, and it just feels like one thing after another. And it's just really hard, and it's a really unpredictable time. And in many ways, it's the most dangerous thing that you can do. Being pregnant, actually, as a woman, it's amazing, and it's got all these wonderful features. But I'm very guilty being an obstetrician. I only see the complicated stuff. I don't see the normal pregnancies. But it is, it's one of the most dangerous things that you can do as a woman. And I think particularly in the society we live in now, we have such high expectations. It can be really tricky to fit that with the reality of when things don't go to plan. I'd say, just be kind to yourself. There's some things you can control and there's some things that you can't. And having the knowledge and understanding about why decisions are being made can help. But ultimately, I think a lot of women, sadly, who go through these kind of issues, there is a lot of trauma associated because they are traumatized because things can happen as an emergency. Your birth plans and preferences can go out of the window. So there's a whole sort of mental health and emotional piece that I don't think we're very good at treating in sort of mainstream medicine associated with this.
my last question, do you have any other tips, suggestions, or recommendations. I feel like so much that you shared. It's like with everything with pregnancy, right? Every pregnancy is different and you just never know. And you definitely have to be really aware of your body and how you feel.
Yeah, absolutely. I'd say, make sure in early pregnancy you have, someone has talked to you about your risks, and that if someone is, should you be offered aspirin, and, if you think you should be and someone hasn't, ask again and make sure if you've got any concerns about it, ask your questions so that you can take it confidently. Really important to, for it's many of the reasons why we have antenatal care is, to get your blood pressure checked. And then if you do have a blood pressure problem, advocate for yourself, make sure that you're, understanding what you're getting treated for, that you can ask your questions so that you can be confident taking medication that's being prescribed. And then the postpartum piece that I think is really which is really both interesting and tricky, is that, we know that women who've had preeclampsia in particular have got a higher risk of cardiovascular problems. So about 4 times the risk of developing chronic hypertension and 2 times the risk of cardiovascular disease. So a little bit like gestational diabetes, it's kind of giving you a window to your future health. And so for those women who have had high blood pressure, I'd say, don't just, it will hopefully get better after you give birth, but, keep on top of it, like keep going back to your primary care provider, get this checked, understand what changes you could make to potentially, reduce your risk going forward, because it's sort of like I said, it's this stress test. So use that information to your advantage to be able to make the changes, pick up the problems so that 5-10 years down the line, you can be in a better place than you would have been without that information, I think is really important. But again, that's something that in the medical system, we're still not good at doing that. So I think that's often ends up being in women's hands because the postpartum space is so fragmented.
Well, thank you so much for all of that. I will have all of your information linked in the show notes so people can reach out to you. And I really appreciate you coming on and sharing all of this, especially because it's such a broad topic. And it is, at least for me, it's so hard to really comprehend some of it because, you just don't know if you have it. As you mentioned, you may have some symptoms, you may not. So this is really helpful.
Great. It was great to speak to you. Thank you.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.